But right now, we're going to get into some COVID news, definitely into the ivermectin situation. Now, unfortunately, ivermectin has been another example of the culture wars here in the United States of America. We have Republicans who are considering it a cheap cure for COVID 19, and you have liberals who are characterizing it as horse paste. It's being called horse paste, unfortunately. Um, and wow, the truth is that it is a legitimate medication. It is a legitimate medicine. That's what it is. You know, and unfortunately, due to our culture wars and the fact that a lot of people on the right have adopted ivermectin, I'm sorry. You have to forgive me, folks. Like I said, things are a little bit hectic here at the studio. We're trying to get these technical difficulties resolved. But yes, unfortunately, because ivermectin is so cheap and because it is so plentiful, there are different versions of it. That's one of the reasons why a lot of conspiracy theories think that it is being suppressed by the media and the medical establishment because it is fairly cheap. You can get it as a generic medication. A lot of different countries have already used it. But what I wanted to get into as a part of this culture war situation and why we should not trust our media is this Rolling Stone article. Okay. Now, this Rolling Stone article essentially said they were forced to contract their article because they said that Oklahoma hospitals were being overwhelmed by patients who overdosed on the drug ivermectin after the doctors cited it was contradicted by the hospitals that particular doctor had referenced. Now, they published testimony from a Dr. Jason McAleya, who told local news stations that the hospitals were being overrun by patients overdosing on ivermectin, which resulted in other patients waiting for treatment for gunshot wounds and, your grandfather has a heart attack and whatnot. McAleya claimed that the situation was so bad that gunshot victims were being neglected. The ERs are so backed up, he said, that gunshot victims are having hard times getting to facilities where they can get definite care and be treated. Now, this story, which originally appeared in Oklahoma's KFOR TV news, was widely shared by a lot of reporters, including Rachel Maddow. And unfortunately, Joyanne Reid picked this up and did a segment on it, as we hear.
And people like Nicki Minaj, I have to say this. You have a platform, sister.
Sorry, wrong.
So things are clearly bad, but they're being made even worse by people who have refused to take the vaccine and instead are swallowing horse paste. The emergency room in one rural Oklahoma town is being overwhelmed by people overdosing on ivermectin, the horse deworming medication. It's gotten so bad that gunshot victims are having to wait to be treated.
This is not true. This is just basic. This is just not true. I'm sorry. And unfortunately, Rolling Stone magazine had to actually retract its story, but not before Rachel Maddow, Joy Reid, as you heard, the Daily Beast, the Daily Mail, Daily Kos, the Guardian, Newsweek, the New York Daily News, The Hill, MSNBC's Jason Johnson, Roland Martin, and Stephanie Rule, and lots of others spread this fake story because they were so happy to be able to make fun of Trump supporters and make fun of people in rural America who were taking ivermectin. So what's the real about ivermectin? What is the real? What is the truth about ivermectin? Okay, ivermectin is a legitimate medication. It was discovered in 1975 and came into medical use in 1981. The two men who discovered it, William Campbell and Satoshi Amura, won the 2015 Nobel Prize in Physiology or Medicine for its discovery and applications. And guess what? The medication is on the World Health Organization's list of essential medicines. Let me say this again. The medication is on the World Health Organization's list of essential medicines and is approved by the U.S. Food and Drug Administration as an antiparasitic agent. In 2018, ivermectin was the 420th most commonly prescribed medication in America, with over 100,000 prescriptions. The drug is also being researched as a way to prevent tropical diseases like yellow fever and malaria. Now let me get this caller really quick. Hello, caller. Hello, caller. Hello, caller. Caller? Okay, so I guess this caller's gone. So we're going to keep on rolling. Okay. It is one of the most prescribed medications of all time. It is. Look it up. And not only that, when the NIH, the National Institute of Health, revised its treatment guidelines for ivermectin for the treatment of COVID-19, January 14th, 2021. Dr. Paul Marik and Pierre Corey, founding members of the Frontline COVID-19 Critical Care Alliance, or the FLCCC, along with Dr. Andrew Hill, researcher and consultant to the World Health Organization, presented their data to the National Institute of Health Treatment Guidelines Panel, and the NIH has upgraded their recommendation on ivermectin, making it an option for use in COVID-19. This designation upgraded the status of ivermectin from against to neither for or against, which is the same recommendation given to monoclonal antibodies and convalescent plasma, both widely used across the nation. Now, they are no longer recommending against ivermectin use. They can feel more open in prescribing ivermectin as another therapeutic option for the treatment of COVID-19 that's made clear its path towards FDA emergency use approval. Now, Dr. Corey said ivermectin is one of the world's safest, cheapest, and most widely available drugs. The study we presented to the National Institute of Health revealed high levels of statistical significance, showing large magnitude and benefits in transmission rates, need for hospitalization, and death. What's more, the totality of trials data supporting ivermectin is without precedent. So you see, they essentially had to walk back the entire thing. They had to walk back the entire story, saying that people were dying by overdosing on ivermectin, when that is not the case at all. That is definitely not the case. Those are lies, folks. Blatant lies. And the hospital where the guy used to work at said he don't work here no more. It's been months since he's been here. But the mainstream corporate media, MSNBC, CNN, Daily Kos, The Guardian, all these other people felt the need to once again make fun of belittle, and denigrate the working class. That's really what this is about. In their minds, they're picturing in Oklahoma these poor white trash rednecks who are following their leader, Donald Trump, and taking horse paste. Well, guess what? There is a horse grade version of ivermectin, just like there's a horse grade version of all the drugs that we take, aspirin and whatnot, and all these other things. There's horse everything. But that does not mean that there's not a human form of these drugs and that they do not work at least a little bit. So basically, folks, I'm just saying we really have to be vigilant in who we trust and who we get our information from. I know I don't want to speak for the Rev because I don't know where he is. He ain't here, but we generally tend to be as fair and unbiased as we can possibly be here on this station. Here every Friday, 6 to 8 p.m. on WLTH 1370 AM and 92.7 FM when terrestrial radio is actually working, when our signals are actually working. But even now here as an internet-only webcast, I'm still going to be as fair and balanced as I could possibly be. Not Fox News fair and balanced, but legitimately fair and balanced. I don't hide my biases. I'm a left-wing populist. That's what I am. That's what, I'm a old school blue collar labor supporting populist, New Deal, Great Society type populist. And so, of course, that's the way I'm going to see different stories. That's the way I'm going to see the world. But even still, even when things run counter to narratives that I have, I still try to bring it. I still try to not bury or hide information just because I don't necessarily agree with it. Now, if I don't agree with it, then I have a reason for disagreeing with it. And I say, let's go do it. Let's debate it. Let's talk about it. What happened to talk about things in this society? What happened to debating issues? What happened to that? Now we just have a media that force feeds its agenda down all of our throats. And this pandemic has been ground zero for bad journalism, biased journalism, which is bad journalism, and destructive journalism, yellow journalism, all in the name of protecting the establishment, the status quo. Now we're going to have to take our first break here on WLTH 1370 AM.